Good morning, Miss Cross. My name is Dawn. I'm going to be your nurse today. And the doctor has ordered that we insert a Foley catheter. Let me go ahead and provide for privacy. I'm going to wash my hands. Okay, Miss Cross, I'm going to check your name band here. Can you tell me your full name? Okay, Christy Cross. And your date of birth? 8758, good. And do you have any allergies to iodine or to latex? No? Okay, great. All right. I'm going to move this over here. Okay. Miss Cross, I'm going to put your bed up a little bit. Put your rail down. Okay, and what I'm going to do is I'm going to keep you nice and warm with the bath blanket here. Okay. And a little bit ago, I know you did some peri-care down below there, so you're nice and clean. Alright. I'm going to keep your legs covered here the best I can. And I do need them spread out a little bit there. Are you comfortable? Okay. Okay, I'm going to work over here on this table for a second, Mrs. Cross. Just let me know if you need anything. I'm going to go ahead and open up this kit. I'm going to put a little garbage bag here to collect some of my stuff. Okay. I'm going to be putting onto your bed here a little bit of a shield here. It's going to make the area a little bit more sterile, free of germs. I'm going to put my gloves over here on the side of the table, not in my sterile field. And this paper here I'm not going to use. Okay, now I need to put my gloves on so I can work with the items in the tray. You doing okay, Mrs. Cross? So go ahead and put on your sterile gloves using sterile technique. Okay, I'm going to straighten out my items in my tray here. I have some iodine for cleaning. My patient's not allergic, so I'm going to rip that open and I'm going to pour that onto my cotton balls. Done with that. And then I have some lubricating jelly to lubricate the catheter. Rip that open and squirt it into my tray. Like that. And this is a specimen cup. The doctor did not order a specimen. If they did, though, we can use that after. And this is our fluid of saline to fill our balloon with. I'm going to go ahead and attach that to my catheter and put that in there snugly. I'm going to take off this covering here, being very careful that that catheter stays sterile and in my box. Okay, done with that. All right, I'm going to tuck that back in there. I'm going to cover up my tray and go to my patient. When I go to the bed, I'm going to make sure that the syringe is facing my patient. That'll make it easier for insertion. Okay, I'm going to carry my tray with my fingers here inside so they don't get contaminated. Put that onto my field. Okay, Mrs. Cross, I'm going to go ahead and clean you down below now. Might feel a little bit cool. This hand is going to become contaminated. I'm going to open up the patient's labia so you can see the urinary meatus. Take your first cotton ball that has the betadine or iodine on it, and I'm going to clean the patient. I'm going to go furthest, closest, down the middle. Okay, furthest, top to bottom. Get rid of that. Closest, top to bottom. Get rid of that. And then right down the center. Okay, you doing okay? Okay, now my lubricant is in my tray, so I want to make sure I keep that handy. I'm going to now expose my catheter underneath there. I'm going to put the lubricating jelly onto my catheter tip, a good amount. Okay, Mrs. Cross, if you want to take some nice deep breaths in and out, just relax. Nice deep breaths in and out. Just relax. Here comes the catheter. Doing okay? All right. Okay, I see urine coming down into my catheter tubing. I'm going to advance 2 more inches. I'm going to stop. I'm going to hold my catheter so it doesn't come back out. I'm now going to inflate my balloon. I'm going to use all the water. Once I have all the water in, I'm going to now let go of my catheter. I'm going to hold down here at this port, take off my syringe. Okay, then we're done. Now we're done being sterile, and what we're going to do next is apply what's called a catheter strap. So I'm going to take my catheter out of the box. This will become connected to the bed frame. And my catheter strap prevents the catheter from being tugged on, therefore preventing urinary tract infections. And they come in many different types of styles. This is an example of just one of them. Okay, and then I would document in my charting the type of catheter that I put in, how large it was, the urine return, how the patient tolerated it, and that I applied a catheter strap. Okay, and then you'll put your bed back in the lowest position and make sure your patient has their call-out and wash your hands. Before I do that, though, I want to mention that if we have a male patient, we have a bit of a modification. So I'm just going to place this here for now. And if we had our male patient, what we would do a little bit different, everything would be pretty much exactly the same. Our cleaning, however, is a little bit different. For the male patient, if they're not circumcised, you'll have to pull back on the foreskin. And then you'll start at the urinary meatus to do your cleaning. Start right at the tip of the penis, clean down and around. Get rid of that into your trash. You're going to do that 3 times. Tip of the penis, down and around. Tip of the penis, down and around. And our other thing that would be different for the male patient would be for your catheter itself. You're going to insert the catheter all the way up to the bifurcation. So it's this part here of the catheter tubing. So insert it up to there, and then you'll fill up your balloon. After you're done with that part, then make sure that you pull back down the foreskin on the male patient if they're not circumcised. Okay, and that completes our Foley catheter insertion for male and female.